Hello guys, today I will discuss about small gut diarrheas. First of all, I'll discuss about acute infective small gut diarrheas. And these microorganisms, they can be of different types and their incubation period can be as little as 30 minutes, that is for Staph aureus, and it can be as long as 7 days as it is for giardiasis. Some of them, they are watery and some of them, they can be bloody. For example, Campylobacter jejuni diarrhea, it can be bloody, and Shigella diarrhea is always bloody. So after that comes to malabsorption diarrheas, and most common in malabsorption diarrhea is celiac disease. In celiac disease, some individuals, they have autoantibodies against gliadin component of gluten, which is present in wheat. So these are autoantibodies, they cause inflammation of villi which are present in the small intestine, and repeated inflammation of this villi, it leads to villus atrophy. And when there is atrophy of villi, there is no absorption of the nutrients, so they are lost in the feces. So this is how malabsorption diarrhea is produced in celiac disease. So this is the picture of the normal villi on one side and the atrophied villi on the other side. As far as the association and clinical presentation of celiac disease is concerned, it can present with anemia, with fatigue, weight loss, diarrhea, abdominal pain, bloating, growth retardation, and different nutritional deficiencies. And since it is an autoimmune disease, so it can be associated with other autoimmune diseases like Addison's disease, or it can be associated with pernicious anemia, thyroid disorders. Then there is another skin condition which is called dermatitis herpetiformis, in which we get blistering rash over the extensive surface of our body, and then it can be associated with small and large gut malignancies. And investigations, as far as investigations are concerned, tissue transglutaminase antibodies, they are quite specific. Other than that, we can also go for anti-gliadin and anti-endomysial antibodies, but these antibodies, they can be negative if patient has got associated IgA deficiency, which is quite common association of celiac disease. And since these antibodies are of IgA type, in case of IgA deficiency, these antibodies, they are not detected in the blood despite of presence of celiac disease. So ultimate diagnosis is by duodenal or jejunal biopsy, in which we are able to see villus atrophy. Treatment is of course by giving gluten-free diet to such patients, and this diet, it may include rice, potato, and maize. So this was all about celiac disease. Rest of the diarrheas, they will be told in the next lecture. Thank you.